Hello everyone and welcome to our module on bones of the lower limb. The bones of the lower limb are about 31 in number. This includes the hip bone found in the hip region, the femur, which is the bone of the thigh, the patella, which is found at the junction between the thigh and the leg, the tibia and fibula, which are bones of the legs, and then we have three sets of bones that make up the bones of the foot, which includes the tarsals, about seven tarsal bones, the metatarsals about five, and then the phalanges about 14. As we move on during in this model, we're talking about each of the bones, what is peculiar to them, and in terms of their anatomic structures, what are the landmarks that we need to note in for each of the bones. The hip bone is first on the list. The hip bone is also regarded as the innominate bone or the os coxae. It is the bone that forms part of the pelvic girdle alongside the sacrum and the coccyx. As you can see in the image, you can see that the hip bone, which is the bone in colors, is connected to another set of bone at the back, which would be regarded as the sacrum and the coccygeal bone. The hip bone is actually a combination bone. It's made up of three bones that are joined together. This includes the ilium in brown, the ischium in green, and then the pubis in yellow. Starting off with the first part of the hip bone, the ilium. The ilium is the largest aspect of the hip bone. It's found laterally, and as you can see in the image, is the part of the hip bone that is color coded as brown. The ilium tends to be divided into two parts. It has a body which is oriented inferiorly, so this part's the body, and it has a wing, or what we call the ala. The ala is oriented superiorly. Ala is the larger part of the bone, so this is the ala of the wing of the ilium. What we need to know is that the body of the ilium is what is connected to the other parts of the hip bone. So you can see the body of the ilium is connected to the pubis, is also connected to the ischium, and the site of connection is what we call the acetabulum. So this site where each of those three bones meet one another is referred to as the acetabulum. The ilium is oriented superior to the acetabulum, as you can see. One other thing to notice is that the wing or the ala of the ilium tends to form what we call the iliac crest, which is one important junction of the hip bone when talking about landmarks. Speaking of specific landmarks on the ilium, these are depressions and elevations found on the bony surfaces of the ilium. We have a total of about six landmarks you really need to remember for the ilium, especially for your steeplechase. This would include the iliac fossa. The iliac fossa is a large depression that is found at the medial surface of the wing of the ilium. And we have the posterior iliac spine. We have the anterior iliac spine, anterior superior iliac spine, and then the anterior inferior iliac spine. These are just projections or bumps found on the surface of the ilium, usually found at the ends, at the beginning of the iliac crest. And this is the iliac crest. Iliac crest is the most superior part of the ilium. The anterior part of the iliac crest is what forms the bump called the anterior superior iliac spine. That's the bump here. Just below that bump, there's also a slight bump called the anterior inferior iliac spine. Then at the back, we have the posterior iliac spine that ends the iliac crest. Other structures of the other landmarks of the ilium will include the greater sciatic notch. The greater sciatic notch is just found at the posterior aspect of the ilium in connection with the sacrum. This is the greater sciatic notch. It's just a depression or curved notch just at that posterior border of the ilium. And finally, we have the gluteal lines. The gluteal lines are found at the back of the lateral surface of the ilium. That's not shown in this particular image, but the gluteal lines are the lines in which the gluteus muscles tend to originate from. The second aspect of the hip bone is the ischium. The ischium is the lower aspect of the hip bone found, is the lowermost aspect of the hip bone found posteriorly and inferiorly, and it's the area marked in green in this image. What you need to know about the ischium is that it is divided into two parts. It has a body and a ramus. The body of the ischium is what is connected to the rest of the hip bone. So you can see the body of the ischium connecting it to the pubis in front and the ilium superiorly. Then the other part of the ischium is called the ramus of the ischium. The ramus of the ischium is continuous with the ramus of the pubis, which we'll talk about very soon. What you need to remember is that the body of the ischium is oriented inferior posterior to the acetabulum. As you can see, it is inferior and it's posterior to the acetabulum. And like I said, the ramus, whereas is connected to the ramus of the pubis. The connection between the ramus of the pubis and the ramus of the ischium gives rise to what we call the ischiopubic ramus. So the continuation of the ramus of the ischium and the ramus of the pubis together is known as the ischiopubic ramus. What are the landmarks on the ischium that we need to pay attention to? The ischium has about 4 major landmarks to remember. This includes the iliac spine. Iliac spine is a bony projection just found at the starting point of the ischium. This is the iliac spine here. And below the iliac spine is also a slight notch that is counterpart to one of the notches that we mentioned for the ilium. This notch is called the lesser sciatic notch. So in the ilium, we talked about the greater sciatic notch. The greater sciatic notch is just above the iliac spine. As you can see, this is the greater sciatic notch here. So below that iliac spine, it's the lesser sciatic notch that we tend to see. So lesser sciatic notch and iliac spine are part of the ischium. Then the ischium also has a very prominent bony projection inferiorly called the iliac tuberosity. Iliac tuberosity is just the lowermost part of the ischium and it's the bumpiest part of the ischium. This is usually the site where we tend to sit on. So whenever we're sitting down, the part where our buttocks or bone, the bone of the hip tends to be in contact with whatever we're using to sit on, whether a chair or otherwise, is the tuberosity. Then finally, one important landmark of the ischium is the obturator foramen. Obturator foramen tends to be formed by that ischiopubic ramus that is formed by the pubis and the ischium. So it is a landmark that we see in the ischium and the pubis as well. So this is ischiopubic, this is the obturator foramen here. It's a circular opening that is found at the site where the pubis and the ischium are connected. Now this picture gives us a better view of the landmarks of the ischium. As you can see, obturator foramen is shown clearly. Obturator foramen, you can see it's an opening found in between the body of the pubis and the body of the ischium, and you can see that ischiopubic ramus connecting the ramus of the pubis and the ischium is found or bordering the obturator foramen just inferiorly. Another landmark that we could also see clearly is the iliac tuberosity. You can see this large bump at the inferior part of the ischium. This is the area where we tend to sit on. And then some other landmarks here are not shown precisely, but this is the lesser sciatic notch here. This is the greater sciatic notch here. And then between them, you have the iliac spine, but not shown in this image. The last aspect of the hip bone is the pubis. The pubis is the most anterior medial part of the pelvic girdle. The pubis it comprises of 3 major parts. It comprises of a body. The body of the pubis is found just in front here. It also comprises of a superior ramus and an inferior ramus. The superior ramus is connected to the acetabulum and is the part of the pubis that is in connection to the rest of the hip bone. So it's in connection with the ischium, body of the ischium, and the body of the ilium to form the acetabulum. The inferior ramus is in connection with the ramus of the ischium to form the ischiopubic ramus. Remember, I said that continuation of the ramus of the ischium and the pubis is what gives rise to the ischiopubic ramus. And then finally, the body of the pubis is in connection with the pubis on the opposite side, on the contralateral side. So the body of the pubis on the right side is connected to the body of the pubis on the left side, and that gives rise to what we call the pubic symphysis. What are the landmarks to note for the pubis? The pubis has a bunch of landmarks, particularly found at the body and some on the superior and inferior rami. In the body of the pubis, the important landmarks to note will be the pubic symphysis, which is the point of connection between the body of the pubis on the right and left side. Is the pubic symphysis here. The pubic symphysis is actually a joint, and we'll talk about it in the joint of the lower limb later on. Aside the pubic symphysis, two important landmarks found on that body include pubic tubercle. Pubic tubercle is a bump found at the edge of the body of the pubis superiorly. This is my the cursor is indicating where the pubic tubercle is, and then we have the pubic crest. The pubic crest is simply just the superiormost border of the pubic or the body of the pubis, and that's what is I'm outlining here. This is pubic crest. Then, as part of the boundaries of the obturator foramen, the pubis, or as a landmark, the obturator foramen as well as part of the landmarks of the pubis, because the pubic bone and part of the pubic bone is bounding that obturator foramen. As you can see, the superior must bound the obturator foramen superiorly. The inferior must bound the obturator foramen anteriorly, and it's in continuation with the isthiopubic ramus. So the ischium, the ramus of the ischium will now bound it posterior and inferiorly, as you can see. Let's talk about the second bone or the list of bones of the lower limb, and that's the femur. The femur is the bone of the thigh, as you can see, it's the bone that spans the entire length of the thigh. It's the longest and strongest bone in the body, and in terms of its articulation and its connection, it's connected to the hip bone through the acetabulum, and then connected to the knee, connected to the leg bones rather at the knee, through its condyles. As you can see, it's connected all the way up to the hip bone, and also connected all the way down to the legs. The femur is a long bone, and considering the fact that it's a long bone, we tend to talk about the three parts of a long bone. Remember, a long bone has two epiphyses and a diaphysis at the center. The epiphyses of the long bones will usually be oriented proximally and distally. So in the case of the femur, we have a proximal end of the femur, which is the proximal epiphysis, as you can see. We have a distal end of the femur, which is the distal epiphysis, as you can see. And then between them, you have the shaft. The shaft is also called the diaphysis. The important landmarks to know in relation to the different parts of the femur. So in the proximal end, we have three major landmarks to remember. And one thing that you need to take home in terms of the landmarks of the femur is its similarities to the landmarks of the humerus. So the important landmarks of the femur would start from the head of the femur. Head of the femur is this rounded aspect or superiormost part of the femur that is oriented medially. And then we have the neck of the femur. The neck of the femur is just the tapered end of that head as it blends with the rest of the femur. Then below that, we have what we call the greater trochanter, which is a bumpy projection oriented laterally, and then a lesser trochanter, which is a bumpy projection oriented medially. Each of these serves different purposes. The head is the site of attachment or articulation with the hip bone to give rise to the hip joint. The neck tends to contain a number of structures like fibrous capsule, like like joint capsule, fibrous capsule, synovial sheath. The greater and lesser trochanters are site of attachment for muscles. So when we talk about the muscles of the lower limb, we'll talk about the different muscles that tend to insert or originate from the greater and lesser trochanter. On the shaft of the femur, we have a number of landmarks to remember. These landmarks are all landmarks that are sites of attachment for different muscles. This includes the linea aspera, the pectineal line, the adductor tubercle. The linea aspera is a rigid line that is found on the posterior aspect of the shaft, so it's found on the back of the shaft. The pectineal line, on the other hand, is just found medial on the medial border of the linea aspera. So if the linea aspera is the structure shown here, medial to that linea aspera is the pectineal line, and then Both of those structures tend to serve as attachments to muscles. As you can see, there are a number of muscles attached to the linea aspera and to the pectineal line. At the lower part of the shaft of the femur, you have a bump that serves as a point of attachment to a particular muscle called the adductor muscle, or adductor magnus muscle. And that site or that bump is called the adductor tubercle. It's found on the medial part of the femoral condyle, and like I said, it serves as that point of attachment for the adductor magnus. The distal end of the femur comprises of about three major landmarks. This includes the medial condyles, lateral condyles, and the intercondylar fossa. So we have the medial condyles and lateral condyles at the side. They serve as points of articulation for the tibial condyles to form the knee joint. Then posteriorly, we have a deepened aspect of the bone of the distal end of the femur that separates the medial and lateral condyles. This is called the intercondylar fossa, the condyloid fossa. This intercondylar fossa is part of the knee joint. It tends to serve as point of attachment to the anterior and posterior cruciate ligaments, which are part of the knee joint. We'll talk about that at a separate module under the heading of joint of the lower limb. On the anterior aspect of the distal end of the femur, we have a smaller space or smaller depression called the patellar trochlea that allows for the articulation between the femur and the patella to form the patellofemoral joint. Moving on to bones of the legs, we have two major bones that form the bones of the leg. They include the tibia and the fibula. The tibia is the medialmost part of the leg, and it is regarded as the weight-bearing bone, and that is in contrast to the fibula. The fibula is not involved in bearing any weight. So when standing, weight tends to be transmitted from the hip to the femur, and then from the femur, that weight is transmitted all the way down to the knee. At the knee, the weight is only distributed through the tibia and down towards the to the ankle, towards the feet, where the balance is maintained. So weight is not then beared on the other bone found in the leg, which is the fibula. Fibula tends to be involved in just forming part of the ankle joint. It's not involved in bearing weight, and that's an important distinction when talking about tibia. In contrast to the fibula, the tibia is weight bearing, fibula is not. Extending from proximal to distal, the tibia tends to be connected superiorly to the femoral condyles to form the knee joint. It's connected inferiorly to the talus and the fibula to form the ankle joint. And laterally, it is in relation to the fibula, forming the tibiofibular joint, which is not necessarily spoken about. Tibia is a long bone, and being a long bone, it will be divided into three major parts: the proximal end, which is the proximal epiphysis, the distal end, which is the distal epiphysis, and the shaft. Each of these parts would have different landmarks that are important to note. Landmarks are just bony projections, depressions found on the surfaces of bones, and allows for attachment or articulation of parts of the bones to other structures. In the case of the proximal end of the tibia, we have three major landmarks to note. This includes the tibial condyle superiorly, tibia tuberosity, and then the soles line posteriorly. The tibia condyle is the most superior aspect of the tibia bone. It serves as the point of articulation with the femoral condyles that we spoke about. The medial and lateral femoral condyles articulate with the tibial condyles to form the knee joint. Between the tibial condyles, there's a slight ridge just found in between. As you can see, that ridge is in blue. That ridge is known as the intercondylar ridge, and it's a ridge that also serves as point of attachment to ligaments of the knee joint, like the anterior and posterior cruciate ligaments. On the tibial condyles, we have some minor ligaments also found there, like the medial and lateral meniscus of the knee joint. We'll talk about each of those structures when we get to the model of the joint of the lower limb. Below the tibial condyles, we have one landmark. The landmark here is called the tibia tuberosity. Tibia tuberosity is a bony projection on the anterior aspect of the proximal end of the tibia that serves as a point of attachment to muscles and ligaments, particularly the patellar tendon tends to attach this alongside some other structures. And then the posterior part of the proximal end of the tibia, we have the soles line. Soles line is a line involved in the attachment of muscle, the soleus muscle, and part of the gastrocnemius muscle. The shaft of the tibia has no major landmarks to know about. What you need to remember about the shaft of the tibia is the fact that it comprises of three major surfaces. We have the anterior surface of the shaft of the tibia oriented in front, and the lateral surface in connection with the fibula, and then the posterior surface, which is a smooth surface oriented posteriorly and buried deep within the leg. The anterior surface is a subcutaneous surface. It is in direct connection with the skin of the leg. If you feel your legs and feel the anterior part of the leg, you could feel a bony projection. That bony projection is the anterior surface of the tibia. It's subcutaneous. And that's in contrast with the posterior surface. Posterior surface is deep within the leg. It's hidden. We can't palpate it, and the reason is because it has a lot of muscles surrounding it and attached to it. Then finally, the lateral surface of the tibia is a part of the tibia that is in connection with the fibula. It is connected to the fibula through what we call the interosseous membrane. As a result, we also call the lateral surface the interosseous surface. The distal end of the tibia has just one important landmark to know, and that is the medial malleolus. It's a bony projection that tends to be oriented medially at and it serves as the lowest part of the tibia. We tend to know this, use this as the landmark for orienting the tibia when we are seeing it live, and we use it to determine whether we're talking about the right or left tibia. The medial malleolus is related to a number of structures, the number of vascular structures tend to pass anterior and posterior to the medial malleolus. The second bone of the leg is the fibula. The fibula is the lateralmost bone of the leg. It is not weight bearing like I said initially. Remember that the weight bearing bone in the leg is the tibia, and it tends to be related to the tibia laterally. It attaches to it proximally and distally. Distally, it is in connection with the ankle joint. Proximally, it's important to know that the fibula does not form part of the knee joint. Fibula is also a long bone, and being a long bone, it would have its proximal end, which is the proximal epiphysis, the distal end, which is the distal epiphysis, and the shaft connecting them. Each of these different parts of the fibula has its set of landmarks that we need to know about. In the proximal end, we have two major landmarks, which includes the head and the neck of the fibula. The head of the fibula serves as a site of attachment to lateral collateral ligaments and some muscles like the biceps femoris muscle. Then the distal end of the distal part of the proximal end is what forms the neck. What you need to remember about the neck of the fibula is the fact that it is the site that is prone to fractures. We have a nerve that wraps around it, which is clinically important in cases of fracture. That nerve is called the common peroneal nerve. The common peroneal nerve wraps around the neck of the fibula. So if there's a damage in the neck of the fibula, you could have disruption of the common femoral nerve, and that will lead to a particular type of deformity or defect known as foot drop. The shaft of the fibula is the shaft that doesn't necessarily have important landmarks to note. What you have at the shaft are surfaces similar to what we talked about for the tibia. The fibula has an anterior surface, a lateral surface, and a posterior surface, and they are all oriented in those positions to give the fibula sites for attachment to muscles. The distal end of the fibula also has one important landmark, which is the lateral malleolus. Lateral malleolus is the inferolateral projection of the fibula, and that is in contrast to the medial malleolus, which is the inferomedial projection of the tibia. So you can see the medial malleolus here. It's the medial inferiormost projection of the tibia on the medial side, and we can see the lateral malleolus also here. It's the inferiormost projection of the fibula on the lateral side. And just like the medial malleolus, the lateral malleolus also serves as a site for that is related as a site related to neurovascular structures. And some of those structures we'll mention when we talk about the blood supply and venous drainage of the lower limb in a separate model. Finally, let's talk about the bones of the foot. We have a total of 26 bones making up the bones of the foot. This is divided into groups of threes, which includes the tarsal bones, the metatarsal bones, and the phalanges. We'll talk about each of them in the next couple of slides. Starting with the tarsal bones, we have a total of 7 tarsal bones, and this mirrors what we have in the bones of the hand, which are the carpal bones. We have a total of 8 carpal bones. So in case of the foot, we have a total of 7 tarsal bones. This includes the talus. The talus is shown here in yellow. The calcaneus, which is the largest of the bones of the foot of the tarsal bones, and that's shown here in purple. The navicular bone, the cuboid, and then we have 3 cuneiform bones. The 3 cuneiform bones are the bones shown in red here. You can see each of them are related from medial to lateral. Let's talk quickly about each of the different tarsal bones. Starting with the talus. The talus is the most superior tarsal bone. It's the part of the tarsal bone that is involved in articulating with the tibia and the fibula to form the ankle joint. It also articulates inferiorly with the calcaneus in purple to form the subtalar joint, and it articulates anteriorly with the navicular bone to form the talonavicular joint. It's a very important bone when we're talking about movement, because a number of movements that we see in the at the foot is done by in relation to the talus bone. Calcaneus bone is the largest bone in the group of tarsal bones. It is located beneath the talus, and as you can see, this part of the picture doesn't necessarily show proper orientation. If you look at the picture below here, you'll notice that the talus is most superior compared to the rest of the tarsal bones, and then the calcaneus is most inferior compared to the rest of the tarsal bones. And then in relation to one another, talus is found superior to the calcaneus, and the combination of those two gives rise to the subtalar joint I mentioned. You can see the subtalar joints from here. The third tarsal bone to note is the navicular bone. The navicular bone is an interesting bone because of its boat-shaped appearance. So the reason why we call it navicular is because it looks like a boat. It's found on the medial part of the feet, and in terms of its relation, it's related posterior to the talus. As you can see, it forms part of that the talonavicular joint that we mentioned. So between the talus and the navicular bone in blue, you have that joint. It is found behind, yes, or posterior to the 3 cuneiform bones. You can see the 3 cuneiform bones just found in front of the navicular bone, and then it's found lateral to the cuboid bone. So laterally, or lateral to it rather, is the cuboid bone. The cuboidal bone is found just at the side. The cuboidal bone is the most lateral tarsal bone in the feet. It is in articulation with a number of metatarsals, and it's in relation to other tarsal bones. So posterior to the cuboidal bone, we have the calcaneus. Medial to it, we have the lateral cuneiform bones and the navicular bone. And then in front of it, it's going to articulate with a number of metatarsals. It articulates with the fourth and fifth metatarsals anteriorly. The last tarsal bone is the cuneiform bone. This is a combination of 3 wedge-shaped bones that includes the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform bones. Their bones are tend to articulate posteriorly with the navicular bone, as you can see. Behind the cuneiform bone is the navicular bone, and all 3 of them are in articulation with the cuneiform bone. In front, they articulate with the first 3 metatarsal bones. As you can see, this is bone 1, the great halus, bone 2, and then bone 3. They are involved in forming joints between those 3 cuneiform bones posteriorly. Then laterally, they tend to form part of the lateral longitudinal arc of the foot. We'll talk about the arc of the foot as a separate module under the same subheading in a later video. The second set of bones of the foot are the metatarsals. Metatarsals are bones that are located distal to the tarsal bones. We have a total of 5 metatarsal bones. Each of the metatarsal bones are unique in terms of their orientation and structure. They are all long bones, and in terms of division, we tend to say that they have a base. Base is oriented proximally. Then they have a head. Head is oriented distally, The head is in connection with the phalanges. The base is in connection with the tarsal bones. And in between the base and the head of the metatarsals, we have the shaft that connects them. The last set of bones for the foot are the phalanges. The phalanges are the most distal part of the distal bones in the foot. They are small, long bones of the toes, and each toe has a total of two to three phalanges. So the first toe tends to be the only one that has two major phalanges, as you can see, a proximal and a distal phalange. Whereas the rest of the toes, the second toe down to the fifth toe, has a total of three phalanges. So they have a proximal phalange, as you can see, proximal in yellow. They have a distal phalange shown in blue, and in between them, there's a middle phalange somewhere there. Let's complete this model by talking about clinical significance. The major clinical implication of bones of the lower limb would be fractures. Fractures is a discontinuity or a break in integrity of a bone at different points. So we can have fractures at any point of the lower limb. We can have femoral fractures in the femur. We can have a tibial fracture, a fibular fracture, pelvic fracture. There's an image that is shown directly below here that is just showing the different types of, femoral fractures that we could have. We have fractures at the neck. We have what we call intracapsular fractures of the neck of femur, which could be subcapital, mid cervical, or basicervical. All these are not important for you to really know until probably when you are doing orthopedics, training to be an orthopedic surgeon. We have what we call the pre-trochanteric or intertrochanteric um, fracture. Um, there's a connection between the greater and lesser trochanter that's called the intertrochanteric crest and ridge, and that connection can undergo fracture, and this is regarded as a form of extracapsular fracture. We have another form of fracture called subtrochanteric fracture. As I said, these are not important things to remember, just for us to really know that in the femur alone, you could have as many as 6 to 7 different types of fracture. The one important part of the clinical significance is in fibular fracture. And as I said before, the commonest site of fracture of the fibula is at the neck of the fibula, and that tends to cause a form of deformity we call foot drop. The reason why that foot drop occurs is because of the damage to the common peroneal nerve. Remember that at the neck of the fibula, the common peroneal nerve tends to wrap around it. So if there's a fracture at that site, it could disrupt the common peroneal nerve and lead to loss of supply of the feet, and that would present as a deformity we call foot drop. Foot drop is just inability to dorsiflex the foot. We'll talk about dorsiflexion when talking about the different joints and movements around the joints of the lower limb. But the ability to dorsiflex is done by the common peroneal nerve, and if there's a damage to the common peroneal nerve, we lose that ability. And what happens is that the feet just automatically takes that plantar flex position, what we call foot drop, and that could stem just from a fracture at the neck of the fibula. And that's one important landmark or clinical application you need to pay attention to, alongside the others like pelvic fractures and tibial fractures. And that concludes our model on the bones of the lower limb.